everybody here. Steve Neuberger from Healthcare for America Now. And as Mary Beth just mentioned, we've got 2 of the 3 committees in the House that have acted, and we think that the House Energy and Commerce Committee might act tomorrow. We have 1 committee in the Senate that's acted, and we think the other committee might act before they go on recess a week from tomorrow. The President was absolutely right when he said healthcare cannot wait, will not wait, and will happen this year. And when he said, don't bet against us. And yes, it is nerve-wracking. We're in the sausage-making part of the process. It isn't necessarily pretty. Dr. Bates knows all about how this process works, having just survived it. And it feels, if you've watched television, like we're in the presidential election again. And by the way, we won the presidential election. Our opposition is really clear. We heard Senator DeMint of South Carolina say, if we're able to stop Obama on this, it will be his Waterloo. It will break him. We're more concerned with our broken healthcare system. And our strength is in all of our voices. Everybody's in this room. It's in the broad coalition that is formed over 125 national organizations representing 35 million people in this country. We're organized around a set of principles, and we had a lot of handouts as you came in, but there's a set of handouts against that wall, if you want to get them when you leave tonight, that talk about the national legislation. There's things against that wall that talk about the Democrats, and then we have state legislation also on that side. So make sure and get handouts as you leave, but we do have a set of principles that we're organized around. And while others may try to confuse the issue and confuse the people who have been waiting for decades to be assured of health care, we have some really basic questions that we're going to use to evaluate legislation. Will we have access to quality, affordable health care? Will our premiums go down so our wages can go up? Is there a strong public health insurance plan to keep insurers honest? And have we eliminated the insurance industry's discriminatory practices? Is there shared responsibility between the government, employers, and individuals? And is there fair financing? How many of you called Congress this week? All right, excellent. All right, on Tuesday, HCAN and our allies made 62,941 congressional contacts nationally, and that's by phone and fax. In a little while, you're going to hear from several of our rapid response team captains how we will create a healthcare heat wave in August. The most important activity in August is that our elected reps hear from all of us and our neighbors, and that we have fun making the heat. So at this point, the 4 of us, Nancy, come on up because you're going to moderate this, I think, are interested in hearing from all of you. And I think we can probably go till 10 to 8, Nancy, so we can get plenty of time for questions, comments.
All right, we want to hear your questions. Let me see a show of hands here. How many even have a question that they want to ask so we can get an idea?